Good afternoon. I am Dr. Kocher from Nutribiome. Today we are going to deal with another subject that has been quite in discussions. People have asked us a lot of questions about it, and a lot of people are waiting to get information about it. The question is, are there any anti-cancer foods, or is there any kind of diet that we can take that will prevent cancer in people? Now, before I tell you about anti-cancer foods, let me make one or two disclaimers here. Number one, we are not cancer specialists. No, we are not. Number two, by any chance, if anyone who is listening to this video, he or she or somebody from the family or nearby, by some misfortune have been diagnosed as having a cancer, then please don't take this advice as a treatment for cancer. We are nowhere claiming this will treat cancer. The mainstay of cancer treatment still remains chemotherapy, radiotherapy, surgery, singly or in combination, and maybe immunotherapy. What we are going to tell you about is, can we prevent the risk of cancer? Can we prevent, or can we somehow keep cancer at bay as much as possible? Now, for that, let us first understand how cancer comes up, and then we will tell you the foods that can help us in taking care of ourselves. Now, see, cancer comes up normally in our body. Every one of us, it is said, will get at least 1 million cancer cells every day. But we are not diagnosed with cancer. We don't develop cancer because our immune system will immediately take care of those cells and will kill those cells, will remove those cells. So we are saved. So as long as we have a good immunity, we have good immune system, our body is healthy and we are functioning okay, we are kind of safe and we can protect ourselves from cancer. Now, the problem comes when our immunity goes down. Now first, why would a cell, a normal body cell, turn into a cancerous cell? See, normally in our body, all our body cells are multiplying, dividing, they are getting replaced. Like we know, the life of a RBC is 120 days. We develop new skin, we develop more hair, we lose our hair. So every cell in the body, including the cells of my liver, my kidney, my spleen, my intestines, they are shedding off, they are dying, and new cells are coming up. Now, why do they die? Because cells have a internal programming system where after a certain age of the cell dies up automatically. It's called apoptosis. Now, by chance, if a cell undergoes DNA mutation, it forgets to die. It refuses to die. So the cell becomes kind of immortal. And if on top of that, our immune system is compromised and immune system is not working properly, then this cell may escape immune system and may keep on growing from 1 to 2, 2 to 4, 4 to 8, and so on and so forth. Please understand, the cell is very, very small in size. Now, by that time, it comes to a size, maybe the size of a pea, when it is palpable, when it is diagnosable, when it is detectable. It can take 10 to 20 or more years in our body for that tumor to grow and come to that stage. So, now, why cells undergo genetic mutations? See, a lot of influences in our body, wrong influences, cause cells to mutate. Maybe environmental toxins, maybe infections, inflammations, radiation, wrong kind of foods we are eating. Okay, these all, for example, people who smoke cigarettes. Now, tobacco is a carcinogen, we all know. 81% of lung cancers are because of tobacco smoking. There was a time when asbestos workers used to develop a kind of mesothelioma, which happened because of asbestos inhaling. Now, people who used to work in chimney factory workers and chimney cleaners used to develop scrotal cancers because of carbon soot. Okay. People who are exposed to radiation, especially ionizing radiation, do develop DNA mutations. Now, suppose, and then infections. Now, hepatitis B virus, hepatitis C virus are associated with liver carcinoma. Epstein-Barr virus is associated with Burkitt's lymphoma. Or Human papilloma virus is associated with cervical cancer. Now, a lot of these infections, H. pylori infection is associated with stomach cancer. Now, a lot of these infections can cause a mutation in the DNA. Now, suppose the cell escapes immunity, it will grow. It will grow at the expense of neighboring tissues. It will grow to a big size, and when it grows to a big size, it needs more nutrition, more sugar, more glucose. What it does is it develops more of blood vessels that feed the cancer itself. Okay. And then some of these cancer cells may go into circulation, go to other places in the body, and we develop what is called as metastasis. So the cancer has spread in the body. Okay. Having said that, so what kind of foods can help us prevent the growth of a cancer or prevent the generation of a cancer? Now, all foods that are anti-inflammatory, all foods that are kind of antioxidant foods. Foods also have the power to stop that extra blood circulation formation for the tumor. Now, these kind of foods can help us in preventing. There are certain foods which have certain chemicals which are directly anti-cancer kind of chemicals. Okay, we'll tell you about those foods. Also, at the same time, there is a need to remove the kind of harmful foods. For example, you should, if possible, totally remove non-vegetarian foods, animal foods that is, poultry, dairy, sugary things, highly sugary drinks are very, very inflammatory. Fried things, fatty things. Fat by itself causes obesity, and obesity is linked with a lot of cancers. Diabetes is linked with a lot of cancers. So you need to keep yourself in good health, remove these things, and go on to right kind of foods. Probably, those foods will help like anti-cancer foods in the body. Now, what are the foods and what are the chemicals that we are talking about? See, even Ayurveda says, if you take more fruits and vegetables, which are generally sattvic foods, which means they are alkaline foods, which means they are anti-inflammatory foods, they will help you. The medical science, as of today, what we know about, a lot of medical literature says, if you consume 7 to 9 servings of vegetables a day, and if you consume 4 to 5 servings of fruits a day of different varieties, different colors by rotation, that will be highly cancer preventing kind of a food. Okay. Now coming to particular things. Okay. Again, as I said, let me check. Okay. Now if you can give up non-veg, give up dairy, give up poultry, give up alcohol, stop smoking, avoid those environmental toxins, avoid fried foods, deep fried foods, fatty foods, sugary foods, chemicalized foods, then probably you have a better chance of kind of, preventing cancer that will come. So these foods are anti-inflammatory, they may slow cancer cells, they may decrease angiogenesis in the body, which is that new blood vessel formation by cancers. They may boost our immunity indirectly. See, please understand, HIV infected people are found to have a lower count of CD4 cells. CD4 cells are immune cells. Now, immunity goes down. Now, one more thing. People who are on immunosuppressive drugs, now people like organ recipients, are also at the risk of developing higher risk of, compared to other people, of developing cancers sometime in future. So, what are the foods and what are the chemicals that we are talking about? Let's talk about those. See, particularly, in particular, foods like garlic. Okay. Garlic has a substance called diallyl sulfide, which is anti-cancer. Now, foods like cabbage. Cabbage has indole 3-carbinol. Rosemary has carnosol. Raspberry has ellagic acid. Grapes have resveratrol. Ginger has gingerol. Soybeans have genistein. Tomatoes have lycopene. Broccoli has sulforaphane, which is very famous anti-cancer chemical in broccoli. Green tea has catechins. It is actually EGCG, epigallocatechin gallate, which is found in green tea also. It is found in dark chocolate also. Mushrooms have a substance called lentinuns, which are again anti-cancer. Turmeric, the biggest anti-cancer, anti-inflammatory thing that you can have is turmeric, which has curcumin. So, What are the basically anti-cancer foods that can help us? Other than the general statement that I made, that all fruits and all vegetables, especially green leafy vegetables, crucifer vegetables and all fruits will help our body. But in particular, green tea, oolong tea, olive oil, turmeric, ginger, crucifers like cabbage, broccoli, cauliflower, bok choy, Brussels sprout, garlic, onion, leeks, fruits and vegetables which are yellow, orange or red in color like carrots, sweet potato, pumpkin, squash, tomatoes, apricots, beetroots, tomatoes in particular and especially tomato juice or tomato sauce, soy containing foods like tofu, soybeans, mushrooms, herbs and spices like basil, mint, parsley, oregano, rosemary, seaweeds, berries, especially blueberry, blackberry, raspberry, strawberry, cranberry, plums, peaches and nectarines, then citrus fruits like oranges, tangerines, lemon, the peels of the citrus fruits, pomegranate juice, red wine in moderation, dark chocolate, a good level of vitamin D in the body, using omega-3 rather than omega-6, which means cutting out on refined vegetable oils. We are actually against them. They contain a lot of omega-6. Omega-6 is pro-inflammatory. Omega-3 is anti-inflammatory. Flax seeds, flaxseed powder, nuts, canola oil, and selenium-rich foods. These in particular are anti-cancer type of foods. Now, for people who are interested in reading further about it, we recommend the following books: the Cancer Code by Jason Fung. There's a book called After Cancer Cure by 3 doctors, which tells once a patient has been treated of cancer, what kind of foods and nutrition he should be on. Then there's a book called Anti-Cancer. It talks exactly about the foods which are anti-cancer kind of foods. There's a book, Patrick Killen's book, who says beating cancer with nutrition. He beat cancer with nutrition. And lastly, this is a book about Gerson therapy. Gerson therapy is an institute. I'm sure it's in Mexico and a lot of places in Europe. It used to be in America also, started by Dr. Gerson, who claim they can kind of cure and treat cancers using food mostly. They don't use chemotherapy. They are against chemo, radiosurgery. But check it out for yourself. We don't recommend that. I'm not advocating it. I'm just informing you. You can read about it. Thank you very much. If there are more questions, get back to us.